Bismillahirrahmanirrahim. Assalamu alaikum. Now the communication station is evidence-based medicine discussed with medical student. So there are other recording in the channel which describe how to deal with the medical student. So, and the main other thing is that first we want to ask the question, and if it's right, then we will appreciate it, and if it is partially right, then we will appreciate the answer. And but if it is wrong, so I can help you in this regard. Just appreciation and just listening and giving feedback and adding something. And now, other things, other different things is that can you summarize here? He will summarize that scenario. And why not you make a seminar on it or PowerPoint presentation on it? So now I'm just discussing the evidence-based medicine, which up to which point we need to discuss here. So how far, Arif, you know about evidence-based medicine? So evidence-based medicine, it is the integration of three things together. Whenever we found our station regarding evidence-based medicine, at least we have to draw two diagrams. This is one diagram, and other diagram is this pyramid. And other last two is not required. So first of all, yes, Arif, you can follow with me that evidence-based medicine, it is the integration of based evidence, research evidence that available, and then clinical expertise, and then patient value. So whenever in our daily practice to improve the quality of our care, when we face a problem, then that time we ask a question, what is? So for asking question, there is 5 steps by which we can go to the through the evidence-based medicine. Can you tell us about it? First, the asking question. Do you know how we formulate the question? Okay, this is one. This is PICO. PICO, it is the P for the patient. Who is the patient? Suppose it is neonate. Intervention is the surfactant. Comparison with the previous CPAP therapy. And outcome is the what is the result? What happens after giving the surfactant? Okay, and so what should be the question? The question should be what will be the outcome following surfactant in preterm babies in comparison to the CPAP therapy. This is our question. So we ask a question. After asking question, our second point here is the access. So access is that we will gather the evidence. Can you tell me from where we can gather the evidence? Yes, it's pyramid. At the top of this pyramid, it is the best, and the bottom of this is the weakest part of this evidence. Okay, and so can you tell me what is the bottom of this? Bottom of this is clinical expertise opinion, case control, and above this there is cohort study, and then above randomized control. Yes, and above all this meta-analysis guideline, etc. Okay, and after this, when we will access our evidence, that after this we have to appreciate that we get this evidence for our neonate, which is 32 weeker. So is the evidence is valid for this child or not? If it is applicable or not, and then we will apply. Following the apply, we will come in this here. We have this base evidence in our hand now, and then we are thinking that does we have the clinical expertise to give this surfactant, and what is the patient's concern? We will tell that the side effect of it, the evidence, what says the benefits of giving it, and after that we will go for access is that means we will make an action plan how we will do this. by this we can do the practice of evidence-based medicine. So if there is time, then they will ask the question. So what is cohort study? What is, if there is time, before 5 minutes we can cover. So 1 or 2 questions for each study, or one study maybe. So we don't know which study they will ask. For easiest method, for the case control study. Case control study is a retrospective study. Can you give one example? When we are searching the cause of a very rare disease, identify the cause such as smoking and lung cancer. This is the case control study. And above this, there is cohort study. It is prospective study. What is the relationship of searching the outcome of the common disease? It is the outcome that we are giving oxygen therapy for all the preterm. What will be the outcome there? Long-term outcome. After cohort study, there is randomized control trial. Randomized control trial is more effective. So there is a control group, and another is the interventional group. We will include the method here to reduce the biasness. Yes, we will check the efficacy. Yes. And after randomized trial, there is systemic review. Systemic review, it is the collection of the all studies of a certain topic. And meta-analysis, it is the statistical study of the collective study. Okay. And where is Cochrane Library? Online collection of database of systemic review and meta-analysis is Cochrane Library. So what is the benefit of the evidence-based medicine? So benefit, it is a good practice, provide the optimum care of the patient, and here there is provide the satisfaction of the patient satisfaction also. What are the difference between the newer and the older? Newer is that here we include the research and the experience, but older one only depends upon the experience of the doctor, which is passes from one doctor to another doctor. And what is the advantage of newer? Advantage of newer is the patient parents all know that the side effect, risk factor, outcome. And which one is the best guideline? National, international. National is the best because it based upon the environmental condition. Okay. And this is all about the evidence-based medicine. So first of all, we will draw the true diagram, and then ask a question and how to formulate this question, Pico manner. And after formulation, we will come to the 5 A's. This is the access the knowledge, appraise this knowledge, and then apply the knowledge, and then go for the access. This is all about evidence-based medicine. Thank you. Assalamu alaikum.